And as Jamaica and the rest of the world continues to battle the global COVID-19 pandemic, there is a search on for solutions. Vaccinations are ongoing, but there is misinformation, confusion, and even mistrust in some quarters over COVID-19 vaccines. One of several drugs being touted as an alternative treatment is Ivermectin. Ivermectin is an approved anti-parasitic drug that is used to treat both humans and animals with a broad spectrum of antiviral properties. Will this drug be made available in Jamaica? That was a question raised by opposition spokesman on health, Dr. Maurice Guy, at Tuesday's Parliamentary Joint Select Committee meeting.
Minister, you indicated last meeting, Dr. Williams indicated that there was not sufficient data on ivermectin yet. Just to find out whether there is any new data and whether the Ministry of Health and Wellness could have an update on that.
Chief Medical Officer Dr. Jacqueline Bissesa McKenzie says the ministry had concerns about the drug's safety.
We do not have a problem to register ivermectin for human use for the unlabeled uses, because that is well documented in terms of its safety, its efficacy, and how it is recommended for usage. So we recognize, of course, that seeing the data out there, many physicians would, because people are looking for methods to treat, and they want to offer something, and they would have seen the studies that they would, in discussion with their patients, would want to try this drug. So we have no problem to register the drug, and in our discussions with our Standards and Regulations Department, we have said that as soon as a request for registration of the drug comes in, we will expedite the process for registration so that the drug would be available in country. However, the recommendation for the registration is going to be for its unlabeled use. But we do know that as physicians, there are several drugs that we would have seen benefits, we would have seen small studies, and we would have utilized those drugs for off-label use with the consent of the patient and acceptance of responsibility. What there is that we don't have enough information on a policy level to say to the population that the benefits of this drug are clearly demonstrated, and the dosage that is, pardon?
COVID-19.
For COVID-19, and that the dosage has been tested and has been found to be effective in the management. I just want to remind the team that the first study that came out that had introduced ivermectin was a study out of Australia, where in the laboratory, the ivermectin was found to have antiviral properties against COVID management. However, the dosage at which that was found to be effective to have the plasma level is a dose that has not been studied in human beings.